Classification of chronic osteomyelitis. The classification used for chronic osteomyelitis is the Cierney-Mader classification and has the following two criteria. The first is the anatomic type and the second is the physiological class. The anatomic type is a classification of the lesion and is further divided into four subtypes known as medullary, superficial, localized, and diffuse. The physiological class is a classification of the host and has the following subtypes. A is a normal host, B is a compromised host, and C is a prohibitive host. B is further divided into BS, which is a systemic compromise, BL, which is a local compromise, and BLS, which is both systemic and local compromise. The anatomic types. There are four types. First is medullary, second is superficial, third is localized, and the fourth is diffuse. The medullary type involves only the medulla without any cortical involvement. It is also known as an end osteal disease or end osteomyelitis. The superficial type involves only the cortex and not the medulla, and the involvement of the cortex is partial. Also, these are usually secondary to a surface defect of coverage of the soft tissue. So this type during treatment will require some coverage of the soft tissue defect. The third type is localized. Here both the cortex and the medulla is involved. However, the entire bone diameter is not involved. This ensures that there is no loss of stability, either before debridement or after debridement. In the diffuse type, the entire bone diameter is involved and there is loss of stability either before the debridement or after the debridement. The important question here is the difference between localized and diffuse type, and this lies in the stability. In the diffuse type, a thorough debridement of the lesion will lead to a loss of stability of the bone, whereas in the localized type, a thorough debridement will not lead to the loss of stability. So, during the treatment of the diffuse type, we will need to augment it after debridement with some sort of fixation, which is not required in the localized type. So, Cierney-Mader classification is important in this sense that it guides the treatment. Coming to the physiological class, there are three types: normal, compromised, and prohibited. Normal is the normal host. Compromised host can be locally compromised, systemically compromised, or both. The causes of local compromise are usually venous, arterial, or lymphatic, and the list is given below, which includes chronic lymphedema, venous stasis, major vessel compromise, arteritis, extensive scarring, radiation fibrosis, small vessel disease, complete loss of sensation, and tobacco use. Chronic diseases are usually the causes of systemic compromise. The examples are malnutrition, renal or hepatic failure, diabetes mellitus, chronic hypoxia, immune disease, malignancy, extremes of age, immunosuppression, and neuropathy. The third type is both, in which there is both local and systemic compromised. Coming to the prohibitive host. A prohibitive host is a host in which the morbidity of the procedure exceeds that of the disease. So, treatment is worse than the disease, and there is no quality of life improvement after the treatment. So, these patients are candidates for palliative care and amputation. So, this was a presentation on the classification of chronic osteomyelitis or the Cierney-Mader classification. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.